I was taking care of my patients on Monday and Tuesday, and so my gynecologist told me that she was going to call me after 6 o'clock on Tuesday. So I finished up with all my patients. I went into my office and I sat down, and of course, you know, mounds of charts and all this work to do. And I thought, oh, you know what? She was going to call me with the results of my endometrial biopsy. So it was 10 minutes before 6 o'clock. I thought, man, I'll turn on the cell phone and be sure that I'm ready when she calls. And so I turned on the phone, and there was a message there. I thought, I wonder who called. And I listened to it, and it was my gynecologist. And she said, oh, hi, Mary. We found adenocarcinoma on your biopsy. I know that's what you were looking for, but don't worry. You can just have a quick little hysterectomy, and you'll live a long, 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 long life, and you'll be just fine. I know you're down in Portland, so you probably know some doctors there. If you want to come to Seattle, maybe I can help you out. Bye-bye. And I set the phone down, and I was here all alone. And I thought, whoa, that's kind of serious. And I thought, I wish she was available, but you know, she was gone from the office. And so in a couple days, she had her medical assistant call, leave a message. Oh, want to be sure you got the message about your biopsy. I said, oh yeah, I got the message all right. So my mind is flashing through, how am I going to take care of all my own cancer patients and take care of myself and be gone for 6 weeks? And as a little sidebar, my associate, who was also caring for patients with me, had decided to leave the practice a week after I was diagnosed. So I had her patients, my own personal patients, and all the new patients. And then me. I was now a patient. The tables were turned. And so, not wanting to upset the apple cart too much, I'm thinking, I don't know how I can take 6 weeks out of my practice, which I probably should do for myself, but what is this going to do to my own patients? And I was struggling with, you know, what should I do with this? And so I went ahead at her recommendation, got my PET CT scan, and it did indeed show lymph nodes that were out beyond the uterus, that were going up the aortic lymphatic chain. So I knew that I was looking at some serious surgery by this time, and also chemotherapy.